Hey everyone, we are back and we're going to chat it up with board-certified pediatrician Dr. Sachdev of Victoria. Doc, thank you so much for joining us virtually. It was a little different, but hey, we make it work, right?
Thank you for having me. Nice to see you.
Likewise. So school is back in session, as we've been reporting. The Delta variant just spreading. What do families need to know about risks for children possibly developing COVID-19?
That's a great question. You know, the risk for children, unlike last year, we're in a totally different scenario now. This time last year, COVID was kind of, the cases were far and few between in children. Of course, we had a big surge in adults this time last year, but children were relatively spared with what we call the Alpha strain, which is the original COVID virus. Unfortunately, Delta seems to have drawn to children like a magnet to a refrigerator. Delta is highly contagious, transmissible, and virulent, and even fatal in not only adults, but we're seeing it in children of all ages. I just had a 2-month-old baby who I saw in my clinic infected with COVID. So people need to take this seriously. Parents need to know that their children are highly susceptible to the Delta strain, and that the children can get not just mildly ill, many of them severely ill and end up in hospital.
Such a scary situation. Now, Doc, is it likely, we've been hearing the reports about the vaccine, is it likely kids under the age of 12 could get a shot real soon?
Well, right now we do have full FDA approval for the Pfizer vaccine, 16 years and above. And between the ages of 12 to 17 years, we do have authorization under emergency use to use the Pfizer vaccine as well, and Moderna is soon to follow. Under the age of 12, the clinical trials are still going on. They're more extensive because we're dealing with younger children, so they take a little longer. They're more in-depth. The data needs to be vetted more carefully. So once all this data is collected, simulated, and presented to the necessary FDA and regulatory boards, we should hopefully by the end of this year or early next year at the latest have approval for one of these vaccines, i.e. Pfizer or Moderna, for the age under 12, even as far down to 6 months of age, which is phenomenal.
Yeah, definitely. Now, before we go to the next question, Doc, I just want to show the viewers real quick, families at home, a chart by the American Academy of Pediatrics shows cases in children, like you talked about, Doc, have increased since July. Another chart by NPR shows children accounted for about 15% of all newly reported COVID-19 cases across the nation. So this is just some perspective for you. Now, as we're here in Victoria, data by the Victoria County Public Health Department shows there have been about 1,552 COVID-19 cases of people under the age of 20. Doc, one last thing before we let you go. Allergies all over the place. How can parents differ? What could be allergies versus COVID? If you can elaborate on that just a little bit.
Sure, that's another great question, Audrey, because I tell you, as physicians, we face that dilemma every day when we see these kids coming in with runny nose, cough, sneezing, red, watery eyes. They may not even have fever. A lot of them are presenting with headaches. It's really interesting. I'm seeing almost every kid who tests positive for COVID has not just the typical allergy symptoms, but they have a really bad headache, which lingers on for several days, which is kind of unusual in kids who have general regular allergies. So that is kind of the differentiating factor I'm looking for, in addition to fever. If they have headache along with these allergy symptoms and they're just not looking good, then I am testing them for COVID, and I have seen quite a few positive cases of COVID in those children.
All right, Doc, thank you so much for this great information. We'll have more information on our website, crossroadstoday.com. We'll be right back.